So help a person who's listening to this podcast navigate the medical world. Let's say they have a problem and they're going to their doctor.
Mm-hmm.
Or is there a general rule of thumb or a formula so you can ask the right questions and make the visit as productive as possible? What advice do you have, perhaps?
Yeah, there's a lot of different things somebody could do. One is just kind of getting an idea of getting an understanding of how is the doctor thinking, how is the doctor kind of integrating this information and using it to try to come up with a differential diagnosis or a set of diagnoses, possible outcomes here. And one of those is really trying to focus on a chief complaint. That's a word we use really to kind of describe really the most salient or most worst or most obvious symptom that somebody might have.
Right. Now, and this is another word. I had patients say, the doctor to get their records, and they say, they said I was complaining.
Yeah.
It's like, no, a complaint doesn't mean you're complaining. A chief complaint means what's bringing you in here. Gee, my head hurts, or gee, my hand is swelling is a chief complaint. It's not an insult. They're not calling you a complainer. All right. So your top issues.
Yeah. Top issues. I often struggle with a way to put that, because we all use the word chief complaint, and when I'm presenting it to a patient, I rarely ever actually use that word.
Yeah.
But it starts with that really, because when a doctor is trying to figure out what's going on with somebody, really it's easiest, might be the best way to put it, if we can figure out the most obvious symptom. If somebody has maybe nausea, vomiting, and abdominal pain, really the abdominal pain is going to be the most specific symptom that they can target to try to do their exam, and then focus on tests to try to figure out what that is.
So maybe a patient can help the doctor by being to the point, right?
Yeah.
Say, well, my grandma called, then I was walking up here, and then I thought this, and then maybe it was this, and I thought it was this. It's better to say, I had a headache at 2 p.m. in this part of my temple, right?
Yeah. Yeah, and it can be hard, because when a patient or when we experience a symptom or something, it's very rare that, we're going about our day feeling like our normal selves, and then suddenly we get a sudden onset of belly pain, and then it started 5 hours ago and it's been this long. Oftentimes it's, I don't feel that good. What does good mean? That's one thing. And then it's maybe abdominal pain or belly pain kind of creeps up on somebody, and it's kind of this subtle thing that kind of develops over time. So it's hard to put a specific time on it. And I think about that myself, every now and then, you get little cramps or something like that. Everybody experiences
Something's
that.
Not quite right.
Yeah. And I think about it myself, it's like, okay, if I was trying to describe a belly cramp that I'm having, how would I describe it to a doctor? And I kind of go through this sort of thought experiment to try to just try to understand, how a patient might be trying to explain it to somebody, and oftentimes if you have a cramp or something, it's a belly cramp, it's kind of hard to say, that started 2 hours ago, to really kind of describe it really specifically how a doctor would.
It's tough, and a person will say, my stomach hurts, and you and I know the stomach is here, and somebody's down here in their tummy, and you say, my stomach hurts. It's nowhere near the stomach, so we have to learn how to translate these things.
Yep, and that gets into a whole other issue. There is that. Really the practice of medicine, it's all about communication. And it's like, I feel like as a doctor, we actually become masters almost of just being able to communicate with people, figuring out how people communicate and trying to interpret what somebody else is saying.
Well, the good doctors get good at communicating. Yeah.
Because it's just like you said with belly pain, a common thing that I encounter is one person's pain is another person's, well, it just hurts. Pain and hurts might not mean the same thing to certain people, and I encounter that quite a bit. Where chest pain's a very specific thing that's we see often in the hospital that we have to kind of differentiate and figure out what's going on. And I frequently will encounter a patient. I say, well, when did your chest pain start? You know, as I have read the admission note and I see it says chief complaint, chest pain. And so the first time I pick up the patient and meet them, I might say, when did your chest pain start? And they say, well, I didn't have pain. You know, I had pressure. And it's like, so, you know, it's like a lost in translation sort of thing that you have to, you know, so there's that element of it, just making sure that, you know, the patient and you are both talking about the same thing.
Yeah.
You know, and that can be a difficult thing to navigate every now and then.
And there's different types of pressure. There's a little push, and then there's the 6-ton elephant sitting on my chest pressure.
Yeah, yeah.